gentlemen, esteemed faculties, proud parents, distinguished guests, and the most importantly, our esteemed graduating class of 2018. So heartiest congratulations to this batch for simply being amazing and remarkable batch. Do I say that to every batch? Yes, because you are graduating from one of the world's most famous medical college and the best medical college, St. Govindas Sundardas Medical College and King Edward Memorial Hospital. So all of you are becoming now GSIs, and that's where you are remarkable and you are amazing. So today marks a momentous occasion in the journey of our medical college, a day which is filled with pride, accomplishment, and a boundless promise. As we gather today for our annual graduation convocation ceremony, we come together not only to celebrate the remarkable achievements you all have done as students, but also to reflect that profound impact you will be doing on the world of healthcare. And these are the people and these are the students and doctors who are going to handle us when we fall sick. So it is important that they have graduated well and studied the medicine well. Each of you have embarked a rigorous academic journey filled with challenges, sacrifices, and triumphs. Few months or 1 year into your MBBS, you all came up with in the midst of COVID. And this was followed by virtual classes, losing the important clinical touch, and alarming panic about getting COVID, infecting others, quarantined, the new drugs coming up, reliability of them, and lots of things which we have seen. The mental health problems which we all faced, being lonely, being depressed, sitting at home, not meeting your friends, not meeting your colleagues. And most important, missing the hospital and patients. The COVID-19 pandemic has reshaped our world in ways we could never have imagined, testing our resilience, our resolve, and our collective humanity, and all of us have stood out with it with bright colors, and we have overcome this. And that's why this makes your batch equipped more than other batches, because you have faced the COVID pandemic. So today you are standing again proud, resilient, and ready to embark on your next chapter of your journey as a healthcare professional, going over to the post-graduation, may or may not be, or also as an MBBS. Remember the importance of empathy, integrity, humility, and sincerity whenever you are touching your patients, your interactions with patients, colleagues, and community. As future healthcare professionals, you have been entrusted a sacred duty. As someone in the beginning said, we are the healers. You are the one who will bring comfort to others in pain. And you are the one who are going to advocate the people in need. So embrace this responsibility with open heart and open mind, and never lose the sight of the profound impact you can have the people whose life you're going to touch. And remember, when you're going to embark this journey, you are not alone. You are a part of a rich and vibrant community of doctors, scholars, healers, and innovators and researchers who are unitedly committed to the advancing frontiers of medicine and improving the healthcare with new innovations and and taking care of the well-being of all. We all saw what COVID gave us with so many new drugs in such a short span of life. So lean on your mentors and your peers and your loved ones whenever you need help. Never feel ashamed to ask for a professional help from your senior or your colleague, because finally you are dealing with a human life. And whenever you are dealing with human life, the utmost importance is to give them the best diagnosis and the best treatment. Never underestimate the power of collaboration and team spirit in achieving your goals. Always collaboration and team spirits together, everyone achieves more, and that's what I believe in. As you go on from here, your education doesn't stop here. You have to be a student lifelong. It's a lifelong pursuit that requires a spirit of curiosity, a thirst of knowledge, and willingness to adapt and grow into the face of new challenges and opportunities. I know today you all have hold this because your NEET has got postponed by 2 months. Whenever you all appear and the results come, and even I know in MBBS results, some of you had setbacks, some of you had triumphs. But take this as an opportunity for growth and learning. Let me give you, the two sentences which I always follow in my life is, whatever happens, happens for good. Blessings are in disguise if there is something wrong has happened. So why do I say this? I have experienced this right from my childhood. When I became MBBS just like you, I wanted to follow my father's footsteps and become an MD Pediatrics because he was a pediatrician holding a unit here. But to that time, the first choice was pediatrics, unlike now. I couldn't get into it because I didn't have so much marks. And I cried and cried and cried, and finally I landed up in MD Medicine. And then I married a husband who was also an MD Medicine, so I had to do DM because we can't practice against each other. But today I'm so happy that I did my DM neurology, and he did his DM cardiology. We were one of the first couple of DM in Maharashtra. And what important thing happened, because I became neurologist, I became professor at a very young age. And so I was a senior most professor, and I became the dean of this hospital and this college. So now you know, I didn't get pediatrics because my stars were much brighter than the pediatrics. So whenever you get your subject, and whenever you are choosing your subject after a NEET, don't choose just because, oh, this is my merit list, at this list I will get this subject, at this list I will not get this, and this I will get this college. Choose a subject which interests you. Choose a subject which you like. Because if you choose a subject just because what are the financial prospect of that, what are the other prospect, and if you don't like the subject, you will end up with frustration. And that carries all your life. I have seen so many people after they have taken up gynec, which they have never liked, and they have changed it later. And then changing is not so easy the way in our profession. In our time it was, we had to know, not pay any money, we just leave, and after 6 months we apply again. But now it is very, very difficult. So please think 10 times before choosing your subject. Consult your parents, consult your seniors, consult your peers, and consult all the friends before you choose. And let me tell you one more thing. Choosing a subject and also choosing a life partner. It's too early for all of you, please. You all are still immature, I feel. You don't know where you're going to get your post-graduation. And as I learn from the youngsters that long-lasting relationship, long-distance relationship do not stand for long. So be careful. So be careful when you are choosing your life partner. It is better that you decide which subject you are going to get, decide where you are going to stay for next 3 years or 4 years, and then you choose your life partner. Maybe some of you have fallen in love already, that you can carry on. I have no problems in that. But if you are not, then think about it. So in closing, let me once again extend my heartfelt congratulations to each and every one of you and the proud parents. Today, your children are going to be the big GSI doctors, and I'm sure all of you are very, very proud of you, and I congratulate heartiest for you because you are the pillars behind them. So I think parents have the maximum contribution in the children's life, whatever age they may be. It may be even at 60. Just 5 minutes back, I had a phone call from my mom. So it is at any age, children always remain children for you, and don't leave them alone anywhere in the life because they always need your parents' help. So there is a bright future lies ahead. May you go from this with courage, compassion, and conviction. And may you continue to inspire and uplift all those whose life you are going to touch as doctors and those who are your patients. You have overcome the tremendous obstacles to reach this moment. You all have worked very, very hard right from school, first standard. You all must be standing always first in your classes, in your schools, and that has finally brought you to GS Medical College. And now the world is a better place because of our dedication, our compassion, and your unwavering commitment to serving others. So that's the hallmark of our community. Congratulations to 2018. The world awaits your extraordinary contributions. I have every confidence that you will rise and meet to the challenges and opportunities that lie ahead and live up to the standards of our prestigious college and be a true GSites. Thank you and best of luck.